Insights from the world's best medical minds. You are watching TheRightDoctors.com.
Good afternoon, friends. I'm very happy to share the plan on TheRightDoctors.com, the India's leading portal for dissemination of correct scientific information about the latest trends in disease management. Today, the world is facing a pandemic of unprecedented magnitude. You know very well that never in our memory we have heard the magnitude of such an epidemic any time in last several years. People talked about plague, but I think we were not there. Then came, of course, SARS, AIDS, influenza, but this present epidemic of COVID is really a big challenge to the humanity. Now, when we talk about COVID-19, is basically COVID-19 is a disease caused by corona. Corona is a virus, but the COVID disease complex is a syndrome of disease affecting many systems of the body, and therefore COVID-19 terminology is used for the people who have got the infection with corona. And how do you cope up with that? It's important that we should have the right scientific information, particularly people who are associated with other comorbidities. If you see the exact statistics, the exact statistics will tell us that the deaths and complication rates are higher in people with comorbidities. Comorbidities thereby are associated, such as diabetes, hypertension, heart disease, COPD, immunosuppression due to cancer treatment or renal disease. And a population is very difficult to say that who will have comorbidities and who does not have comorbidities, because the comorbidity is also increasing enormously today. You see the prevalence of diabetes in India, and for every known diabetic, there is one unknown diabetic. So it's a great challenge. Why it's a great challenge? Both diseases perpetuate each other. A diabetic patient's spectrum of COVID is different. While if a COVID patient, if he doesn't have diabetes, the outlook is different. And therefore today we are going to discuss how COVID affects diabetes and how diabetes makes the COVID more complicated. So we are trying to fight two enemies. Which one is bigger is a matter of individual. Some people can manage that and they can manage COVID well. Some people cannot. And therefore, I'm going to discuss first what are the problems, general problems of COVID. First of all, the prevalence of COVID is increasing. The number of cases, you look at the TV, every day, the number of cases in Mumbai. I'm giving one example of a small city. Mumbai, how many new cases? But the point of solace, is that supposing there are 50,000 cases, 1,000 cases have recovered. So recovery rate is 50%, which is definitely increased. So there's a matter of relief. And I give full marks to Bombay Municipal Corporation administration, Maharashtra government for taking absolutely scientific steps and most important, imposing discipline. One thing you have to admit that personal discipline is extremely important in life, whether you have COVID patient, diabetes. Lot of achievements are because of a great deal of personal discipline. The discipline we are taught in school when our parents and grandparents very were appeared very tyrant when we are young, but we did things like we were taught to wash hands before eating. I think these are all practices taught to us as a matter of culture. Unfortunately, people have forgotten these disciplines inculcated in childhood, and it was unfortunate that when we used to see the clippings of a social distancing violated and the police beating up the people, educated good people were beaten up by police, which was a pathetic story because it clearly showed that our society lacked discipline. One day the lockout is open and the bazaars are open, you suddenly see the social distancing is completely violated. People go to bazaar as if they have never gone to bazaar earlier. They don't observe social distancing, and there's a crowd overcrowding as if everything is over. My dear friends, remember, everything is not over. The peak is yet to come. The community transmission has not yet begun. What is community transmission? One person, asymptomatic COVID patient, can infect people. These two people will infect four, four will infect eight, eight will infect 16, 32, 1, and you go in the multiplication. And in a matter of no time, one person has passed on this bug to more than 50,000 people. And that's how they are expecting that if this lockdown is opened up without observing certain discipline and certain norms which have been told to norm, like social distancing. Indians have a habit of clinging to each other. They have a habit of just sticking to each other. You go to a bank, when you come to the cashier, the person next to you, who's the next person on the line, he's virtually leaning over your shoulder to see how much calculated. He sometimes puts quite a few objects of his body on your body. He does not keep a distance that he has to stand below that yellow line. They don't follow that line. So this is a basic culture. We tend to cling to each other. गले में गला, हाथ में हाथ. Understand how people do this, and this has to be taught. Primary thing. Primary thing is a social distancing. Keep a distance of at least 6 feet between the two individuals. Difficult because there is no space available. Bombay is overcrowded. Even if you ask the people to stay at home and observe social distancing, unfortunately, people staying in a room of 10 by 10, 8 people, how are they going to observe social distancing? So, social distancing is a matter of geographical availability of space, but one can make at least avoid contact. Do not shake hands. Do our traditional namaste, which is a better way to greet. And most important, there are certain things that you have to follow. Most important is greet without touching. Be responsible. Promote greeting without any form of physical contact. Maintain physical distance. Please remember that. Follow distancing norms in public places. When the lockdown is open, make sure you keep sufficient distance when you stand in queue, especially when you go out to shop. Also follow distancing norms when in a room or in the elevator. When reusable hand Wear a reusable handmade face cover or mask all the time. Cover your face and nose with a reusable cloth. Anywhere you go, please cover your nose and face. Most important, mask should be worn all the time. Remember three key occasions one must definitely wear a mask: when you're sitting in a meeting. You can make a face cover at a protect yourself. Log on to www.mofu government in the read the manual of how to make a face cover. Hand sanitization. Washing hands frequently with soap which must foam. It is not the soap. Remember that. It is the foam of the soap which kills the cell wall of coronavirus. So you must wash your hands with soap in such a way at least for 30 seconds. So there is a lot. Just applying little hand cream and putting under tap does not help. Now these are all very important things. When you sneeze in a handkerchief or a tissue paper, you dump it properly. Use a sanitizer to clean. Don't use sanitizer for fruits. Wash fruit water. Wash it with running water. These are the important discipline measures that one can take. And now, what are the things a diabetes should do? Diabetes control during this pandemic is of utter importance. The control of sugar, target that we all look at control of diabetes. Unfortunately, people don't frequently. Blood sugars are done once a month, once in 2 months, or they do HbA1c every 3 months. You need to check. If you are a long-standing diabetes, you need to check three things. One, whether your blood pressure is under control, and 140 systolic. Two, what is your fasting blood sugar? Your fasting blood sugar should be less than 140 at all times. What is a postprandial blood sugar? It should be less than 180 at all times. If you have an opportunity to do HbA1c, it should be less than 7.5. You must not leak proteins in the urine. You must check what is known as eGFR, that is glomerular filtration rate, And you must also get your ECG done. Now remember, there are many symptoms of COVID. Now today COVID is classified into three simple types of COVID cases. One is asymptomatic patient who is COVID positive, but he needs isolation, he needs quarantine, he needs separation from the rest of the members of the family, but he should not be treated like a achut. He should not be dumped. The society should look at in a sympathetic manner and not boycott him or boycott his house. Your attitude towards these people must change. You should be more sympathetic. And these asymptomatic COVID patients are definitely a danger to the society, but if they isolate themselves or they put themselves in quarantine, they do not pose any danger of transmitting the disease to other non-COVID patient. Now, what has happened today? COVID positive patients who are asymptomatic, who have no symptoms or very mildly symptomatic, are not admitted because the beds are full. There is not a single bed available. My hospital, Raheja Hospital, I got 96 COVID patients admitted. And there are hardly 8 or 10 patients who are non-COVID. And the people who do not have COVID do not want to come to this hospital because it is now labeled as a COVID hospital. Of course, it is giving one of the best cares in the country. Our mortality rate is the lowest, and the patient recover also quite fast, and a minimal expenditure, and there is a capping. There is no exploitation. The government has done a very good thing that they have done capping of the charges. Nobody can charge exorbitantly, so people should not be afraid. But if you can reduce the number of admissions for primarily non-symptomatic patients or mildly symptomatic patients. Now, what are the mild symptoms? There could be body ache. There is a mild low-grade fever which responds to paracetamol. There could be slight sore throat. There may be mild diarrhea which subsided in one day. I would consider they are mild symptomatic patients. They just need observation. They need to visit their family doctor and he should write down the symptoms, and they should look for two warning signals. Number one, breathlessness, and they must have a pulse oximeter. If the pulse oximeter shows oxygen saturation less than 94 and the respiratory rate goes slightly more than 20, or the fever does not respond to normal paracetamol treatment and goes above 100, it's an indication to visit hospital. So they are mildly symptomatic patients which need more vigilant observation, and they should give a feedback to their primary physician or the center they have visited earlier, and there should be vigilance, surveillance, and reporting. Most important, people hide. It's very funny. People who have COVID, they don't declare because they are so scared of social boycotting. There is something known as social distancing, not boycotting. People must realize distancing means you accept him in the society, but don't stick around with him, don't be in a close contact with him. So this mildly symptomatic patient also can avoid hospitalization, but they are on vigilance. Now, what is the success that we have achieved? Our task force, which consists of some smart doctors, and I think they have done a splendid job by controlling the multiplication which was going. I think the duplication of the cases were doubling interval, what we call it, was 5 days, 6 days. It has now become 23 days. Itself is an achievement. Although number of cases are increasing because we are doing more number of tests. We are doing more number of tests, that's why more number of cases are coming to light. But the death rate is still, because if you can control the death rate and if you can increase the recovery rate, it is a success. Today, Dharavi has shown that a very vigilant methodology of BMC of door-to-door survey and door-to-door educative programs has curtailed a widespread flare-up in a most congested population in the country, such as Dharavi, has brought down the prevalence or at least the doubling of COVID cases. So it is achievable. Social distancing, wearing mask, washing hands, attending to comorbidities seriously. People with diabetes need to observe certain restrictions of diet. Now, this problem you will realize that because of social distancing, you and your wife are sitting at home and watching TV. There are some interesting channels which I also see with my wife. Food, very, very tempting. And then you have a lot of free time. Your wife is very keen on pleasing you to keep you in good humor. And unfortunately, food becomes a source of entertainment, pleasing each other, showing love and affection. And then you have nothing else to do, and you have achieved the taste that you wanted. In the same way, what this company, Sanju Kapoor and all that show so nicely, and you have got it. So one day one dish, second day other dish, third day some more, fourth day you suddenly realize that in spite of your regular exercise and cycling and washing utensils and sweeping floor, because there are no maid servants, you stand on the weighing scale and you put on 2 kilos of weight. Now, this is the first thing a diabetic should avoid. Lack of activity. See, we are not very active what we were when the lockdown was not there. We're traveling, going for work, and now we're sitting at home. Our activity level, although the fact that we do a lot of household chores, there's certain household jobs give a lot of energy calorie consumption, like ironing. If you iron your clothes for 1 hour, it is as good as running for half an hour. And if you do pocha of a house which is about 800 square feet and do it really properly, sitting on the ground, it's a fantastic exercise. But at the same time, there is always a danger. Fortunately, the bazaars are open. The food is available in plenty. And during the time when you are watching movies, you have a lot of free time to eat. This should be avoided by a diabetic patient. As if you have to control your diet. That's one of the reasons you have this with you, a meter, a mobile. Check your sugar. Now, this is an opportunity for you, which you have not done it in the past several years, is study in your own body the food genomics. What is food genomics? there is a calorie count of each food, which is standard, which is written in the tables. But how does a food act on your body? And that is based on your pind, your genetic makeup. A mango can increase your blood sugar by 100 milligram, and a banana can increase your blood sugar by 100 milligram, but it is not universal for all the patients. Some people it might go to 45, some people might go to 50, some people, if a banana can increase blood sugar by 200. So you have an opportunity to study, if you eat which food, how much does the sugar go up. So make a note of that, which you never had a chance to see all these years, and take down in a log book that today I had two chapatis and my blood sugar 2 hours after lunch was 180, but I had a bowl of rice, which was a thick rice, not fine rice, and my blood sugar went up by 75. So the myths that chapati is better, the wheat is better than rice is busted. In fact, nowadays we feel that people should not eat wheat. People should eat what is known as panchadhanya, nasani, jwari, bajri, wheat and maize. This has a less glycemic excursion and less glycemic index. So all these things you can see for yourself. Then second thing, accustom exercises which you are using all this time. Supposing you have a bicycle at home, static, and you run it for 25 minutes, check your sugar, check your BP, and you'll be surprised that the sugar might come down, but the BP might go up. If the BP goes up very high, more than 160 systolic, and remains for more than 10 minutes, it's a time you have to reduce your number of repetitions. So monitoring BP and monitoring sugar, these are two beautiful opportunities for you to prevent a lot of comorbid diabetic patient. Then of course, personal care. Now people have been telling to wash all the time. You have to wash feet as well. Remember, many people who walk outside the house wear socks and shoes. And because of our cultural habits, we take out our shoes and possibly walk barefoot in the house. That's the time you need to take more care. Protect your feet at all. Preventable comorbidity in a diabetic patient. Put utmost attention. Put utmost attention to skin fold thicknesses, axilla, groin, and wherever there is a chance, because prolonged sitting and sometimes using unwashed clothes, because maid servant is not there, people tend to use the same pajama and shirt and may develop fungal infections. Attend to that. Skin has to be taken good care. Take good care of your hair. Take good care of your teeth. You got enough time. You brush your teeth at least 3 times a day. There is a great paper which shows you brush your teeth 3 times a day. The chances of coronary artery disease are brought down by 25%. Only cleaning your gums properly will prevent coronary artery disease. So this is what is possible. You got so much of free time. Now the most important aspect that I need to tell all my friends in a diabetic patient, diabetes have two major mental abnormalities. Their cognitive functions are excellent. Some of the diabetics are brilliant people. But because of this lockdown and fear, what will happen to finance? What will happen to my business? And it sets in a depression. The depression due to disease and the media are doing a fabulous job of depressing the entire country. As if COVID was not sufficient, they have put China. They are now showing what is China doing and what is our Uttar, how many soldiers they kill. Continuously they show. So if you are wise and if you are really evolved, do not watch TV and various channels and particularly the news. See some nice classic movies, listen to music, listen to entertaining program, and don't listen to news all the time. And therefore keep a positive approach. Remember, in COVID, out of 100 cases, only one or two, the mortality rate is 0.3, only 3% in our country. Other diseases kill patients more. We have more fear to worry about tuberculosis, diarrhea, infantile infections. COVID is nothing for Indians. People don't die. And therefore, if you observe certain norms, particularly in diabetic patients, the mortality can be easily reduced. Now, there is a lot of rubbish about herd immunity. What is herd immunity? When the 70% of the population suffers from a particular illness, they develop natural immunity. And people talk all rubbish that Indians, now today there was a write-up saying that people with blood group of A are more vulnerable, people blood group O are protected. All these new theories keep on coming and giving different reasons. The guidelines also keep on coming. The coordination between WHO, BMC, Maharashtra government, central government, and policy needs to be more authentic. Luckily, in Maharashtra, things are handled in a very scientific manner. We have a very good team of task force and Operation Zero. COVID is a thing that they're going to implement. So we are quite hopeful that we'll be able to curtail the deaths. I won't say that the epidemic, the number of cases will reduce, they will definitely increase, but the morbidity associated with comorbidity, I'm very sure if the people take a very intelligent form of thinking, become more aware of correct scientific information. Now, guidelines have come up recently. They are very intelligently written, which patients to admit, and what are the various lines of treatment. Now, I'm not going to discuss that because there are about 5 or 6 new drugs. Now, many drugs, why they are promoted heavily and why they are said they are not good and all, there is a lot of industry driven monetary gains and political pressures. I'm not going to go into details of that, but the hope, there is a definite hope. People with a full-fledged COVID, with a respiratory failure, with the oxygen saturation dropping less than 56%, in my own hospital, some of my doctors have recovered with the modern treatment, and this treatment has to be given by the specialist in this field. There's a new terminology which has come up known as Covidology, and there are confirmed Covidologists who are basically respiratory trained physicians, and they know how to handle the respiratory problem and the infective problem coming secondary out of COVID, and the cytokine storm and pulmonary damage, which is in the form of coagulopathy. And therefore, there are protocols which drugs to start first, which drugs to be added, role of methylprednisolone, load of hydroxychloroquine. Now, hydroxychloroquine is not a new drug, but sparingly, particularly people with existing cardiac abnormalities or rhythm abnormalities should be spared. And there are new drug antiviral which are promoted and offer a very promising result, so you don't have to get worried. First of all, COVID does not kill. What kills you morally, spiritually, financially is the fear and phobia. डर से दूर रहो. Do not fear this disease. Treat this disease. Don't treat it lightly. But when you observe disciplinary measures, both in terms of isolation, segregation, repeated testing, more number of vigilance, more number of surveillance, more number of education and therapy, we will be able to curtail this disease and we will be able to live comfortably. A lot of people ask me, when will it get over? I tell them that Indians are very resilient people. How we have got used to corruption, thefts, frauds, financial frauds, and dirty politicians. Society got used to them. We learn to live with them happily. Not very happily, but we tolerate them. We have to learn to live with COVID like we have learned to live with so many adversities in our life smilingly. COVID is not going to go so soon. Get it very clear. I am not a person who will say कि September end, after Diwali, winter, rainy season will worsen. Nothing. I am not saying anything because all these theories have no scientific basis. My objective is to treat my diabetic patients aggressively so that they don't develop any complications. Or the complication develop, we can treat them, particularly nephropathy and cardiac problems in a diabetic patients worsen. And in an early stage, be aggressive in treating the mortality. The mortality is entirely dependent on your personal discipline, your personal nutrition, the number of hours of good sleep, and the physical activity which keeps you up and about and make you smiling. The advantage of exercise, people who exercise regularly at a good level of exercise, a good aerobic, where the pulse rate goes to about 100, this is known as beta. What is beta endorphins? Beta endorphins are your endogenous morphins. Endogenous morphin gives you high. People who regularly walk or jog or do physical exercise are happy. They are not depressed. They don't crib. आज ये नहीं है, आज मेड सर्वेंट ने, oh, no problem. I will do this. I will face it. And they dispense happiness. People who regularly exercise are very happy souls. They not only are happy themselves, but they bring happiness to the rest of the family members. So there is no doubt that exercise is a mainstay of remaining fit. A good sleep also is restoring. If you have sleep apnea, use an apnea machine because hypoxia is dangerous. Desaturation should not happen. So maintain your oxygen level at least 96 and above by using a pulse oximeter. Make it a habit to check it 3-4 times a day. And if you follow these principles and this basic discipline, I'm sure you will be able to overcome problems of diabetes in COVID. So, friends, we have elaborately discussed management of diabetes and COVID. I'm sure maybe a lot, but I have tried to simplify the entire process, try to take out all the misunderstanding about both the disease, diabetes as well as COVID. And I'm sure those people who have this problem will be able to live a very comfortable life. Thank you very much for TheRightDoctors.com for giving me a platform. I was very happy that I come on this standard portal which disseminates very thorough scientific information. I also watch the program very frequently. So good luck and have a safe few months ahead and improve your health and well-being. Bye-bye.
Insights from the world's best medical minds. You are watching TheRightDoctors.com.